So one of the biggest nerves in our body is our sciatic nerve. It can be the size of your thumb, and it starts from lumbar 5 vertebrae and goes down through S1, 2, and 3, and it forms a big nerve that then runs through your buttocks. And so when we need to release that, one of the things that we have to do is find it as it comes out of the gluteus and runs down through the 2 hamstrings. And so we listen in, and often it will take me back into the sacrum where it's coming out and the nerve roots are coming out, and that's what it's doing right now. I listen and I follow it, and I follow it until it ends. It's just ended. And it slowly starts to unravel, but it hasn't yet. So I just keep listening and I am patient. The body will know, and the body will unravel and let it go when it needs to. Here it starts to come. The patient might feel the warmth. She might feel tingles down the legs to her toes, because this is the longest nerve and ends at the heel and the plantar fascia of the foot. The next place we can often release it is again in between the hamstring muscles, and also in the popliteal fossa of the knee before it bifurcates, meaning splits, and wraps around to the front of the leg and wraps around down through the calf. Now, when people have tight sciatic nerve, they can have issues from compression that's enough that they can have weakness. They can get a foot drop. They can have weak hamstring muscles, gluteus muscles, but they can also have pain that can radiate down. We all have heard of sciatica, but it can radiate down their leg and affect all the way down to giving them plantar fasciitis. They can create tightness in their calf. One of the things that's really important to understand is not just the patient's anatomy and the anatomy of the body and the tissue, but the mechanical function of that anatomy. And what's important about ambulation and gait is having enough dorsiflexion of the foot. And when you have limited dorsiflexion of the foot, you need to have, it requires flexibility of your calf muscle. So what can happen is if that's tight, you can't dorsiflex, you're gonna start to collapse at your arch and get plantar fasciitis. So again, we don't chase the pain, we chase the dysfunction. And so the dysfunction component is not where the pain is in the foot, but it's possibly through the sciatic nerve, anywhere in the line and the chain where it starts through the gluteus all the way down. So that's how we take care and treat neuromobilization of the sciatic nerve.